Happy to welcome you all for this lecture. I am Dr. Winnie Joyce, working as an assistant professor in the Department of Social Work, Krishna Jayanti College. Today, we are going to see the areas of psychiatric social work. Areas of psychiatric social work are expanding with the progress and development in the field of mental health. In the present context, psychiatric social work is defined as the applications of methods of social work, that is social casework, group work, community organization, welfare administration, social action, and social work research in the field of mental health. There are three major purposes of psychiatric social work in the area of mental health. One is promotion of mental health and prevention of mental health problems, early diagnosis and prompt psychosocial intervention, and psychosocial rehabilitation and aftercare of person with psychiatric disabilities. There are different roles played by the psychiatric social worker in different field. Let us understand of each area. The first one is inpatient and outpatient services. The services rendered by psychiatric social workers to the patients in the psychiatric setting, de-addiction, neurological, and neurosurgical wards, and their respective outpatient departments are a meaningful mixture of independent psychosocial therapeutic activities at individual, family, and group level. The activities focus on the psychosocial study of the patients and their families, formulation of social diagnosis, providing appropriate social treatment. This takes the form of systematic gathering of information, recording of case histories, making home visits, collateral context, explaining and educating distressed family members. Depending on the problem, the family-centered casework services are offered. The psychiatric social worker makes special effort to involve the significant others in the helping process. Mobilization and utilization of resources in the family and the community for the welfare of the patient have been guiding the principles of psychiatric social work services. Each and every psychosocial situation and problem posed a great challenge to the psychiatric social workers, and the efforts have been made to improve the quality and quantity of such services to the outpatients and inpatients, mainly through social network approach and involvement of volunteers from welfare agencies. The next area is child guidance clinic. Psychiatric social work and child psychiatry have a long history of cooperation. Considering the nature of psychiatric manifestations in children, the focus on psychosocial situations have been well emphasized in working with the disturbed children and adolescents as well as their family members. Therapeutic group activities with children and parents, individual counseling sessions with siblings, interpretation of the problem to the school authorities, and liaison with child welfare agencies are the major components of psychiatric social work intervention in the clinic. These services have been offered both at outpatient and inpatient levels. In addition to these services, the psychiatric social workers collaborate with psychiatrists and clinical psychologists in organizing different welfare-oriented therapeutic programs for the children and their families. Social work service in the child and adolescent unit have immense potential for being models to their counterparts in India and other developing countries. The next area is Family Psychiatric Center. The psychiatric social work services focuses on the marital problems, family pathology, and other interpersonal adjustment difficulties in the families. These are handled at individuals as well as family levels. All the family members admitted to the center are guided to participate in group sessions in order to explore the possible solutions to their problems. Family therapeutic programs which are applicable to our socio-economic and cultural milieu have been extended to the families through the staff and the students of psychiatric social work. On the basis of the services rendered in this unit, the psychiatric social workers have been developing indigenous models for understanding the marriage and family related problems, as well as preventive, promotive, and therapeutic intervention models for them. The next area is services in rehabilitation and aftercare. Rehabilitation is one of the core activities of psychiatric social work. Disability assessment, employability, integration into the community, and re-socialization are the important areas where services of psychiatric social workers have been extended. Some of the rehabilitative services extended to patients include aftercare and resettlement for long-stay patients, job for mentally and neurologically disabled, social skill development programs, sponsorship programs, and self-help groups. The potentials of rehabilitation of the patient are assessed in accordance with the potential help from family members, relatives, friends, and community resources. Problems to be encountered at every stage of vocational and social rehabilitation have been studied individually, and appropriate psychosocial solutions were offered to the patients and their families. The next area is neurological and neurosurgery services. Patients with neurological illness and disabilities are offered the psychiatric social work services. This help is in the form of educating the patients and family members, use of casework and group work services to the disturbed family, and providing specific rehabilitation services. Particular attention has been given to chronically disabled patients. Families have been counseled and guided with regard to the future activities and are informed about the social security services and other resources of help. Regular home visits, agency contacts, social and vocational rehabilitative measures have been undertaken whenever it is necessary. The next area is community mental health programs. The method of community organization and social action have been the main models of delivering mental health services in rural and urban communities. Community participation and mental health education have been the important domains of psychiatric social work services. Psychiatric social workers actively participated in community care programs and training programs for the medical and non-medical personnel. Local leaders have been involved in mental health programs. Involvement of social work students, teachers, volunteers, and others interested in mental health programs from welfare agencies is also a focal area. The psychiatric social workers take active role in organizing the neuropsychiatric extension services at different taluk headquarters. And in the pioneering programs like district mental health programs as advocated by the National Mental Health Program for India in the year 1982, the psychiatric social workers have been significantly contributing the psychosocial components like community education, community participation, intersectoral cooperation, coordination, training of multipurpose health workers, and evaluation of the programs. So let me conclude saying the psychiatric social workers are offering a certain services such as psychosocial study of the patients and families, home visits for the diagnostic and therapeutic services, providing marital counseling and therapeutic intervention services, group interaction and intervention services for patients and family members, and training the para-professionals and non-professionals in mental health services, community participation, voluntary agencies involvement, mental health camps and outreach programs are the major functions of the psychiatric social worker. Thank you so much for your patient listening. Let me meet you in the next lecture.